Help is now available for the thousands of people in North Simcoe who are without a family doctor. It's called CHIGAMIK, an Ojibwe word, and it means people's place. It's a new medical clinic that helps break down barriers, providing medical services for all residents in the area. Our Elizabeth Smith has details on how it works.
It seems that no one is unaffected. You either don't have a family doctor or know someone who is looking for one. And you might find the numbers in our communities quite surprising. In the Midland area alone, there's currently a shortage of 15 physicians and 16 specialists. But despite statistics, there seems to be some light at the end of the tunnel, and it goes by the name of CHIGAMIK.
Welcome to the People's Place. Let's go on a tour.
Communications specialist with the almost year-old Community Health Centre, Amanda Olszewski, takes us on a tour and says the health center is multifunctional.
CHIGAMIK Community Health Centre is a non-profit, community-governed organization that truly works to keep people well. We are one of 72 community health centres across the province that are working towards building a healthier Ontario. We are also the first and only tricultural and bilingual community health centre across the province.
The centre opened its doors back in February of this year and provides health care to those throughout the North Simcoe-Muskoka area.
Our services are available for people who don't have a family doctor living in Christian Island, Midland, Penetanguishene, Tay, and Tiny. As well, we have made it a top priority to extend our service area throughout North Simcoe-Muskoka. So our services are also available for people who identify as Francophone and Métis, Aboriginal, or Inuit throughout North Simcoe-Muskoka who don't have a family doctor.
The centre is located here at 845 King Street in Midland and has over 700 clients so far, something that clearly highlights the need for a health centre like CHIGAMIK.
It's about time, I think, that people have the option of receiving their health care services in English and French, and also to really come into an organization where they feel that everyone really does matter. Every family, every community, every individual, that's really what we take to heart.
Taste doesn't... I have no taste buds.
Down the hall is Gary Schell. He is from the Midland area and undergoing cancer treatment. He has been without a local family doctor for about a year, and he is pleased with how quickly they were able to find him an appointment here at CHIGAMIK.
I did have a family doctor, but he was living far away, and I wanted somebody closer to home. I heard about this place, I called in, and they've taken me right away, which made me very happy. This place is very important because my health is very poor, and this place here has been helping me quite a bit since I've only been here a short time.
The health centre has a wide variety of service providers, from nurse practitioners, addiction counselors, traditional healers, to physicians. Dr. Daniel Schechter is originally from Montreal, but after spending some time during his residency in the Midland area, he decided to come back and join the CHIGAMIK team in July.
I love the philosophy and the patient population. It's a great team that we're working in. We have a full complement of providers, and I love the fact that we can really concentrate on providing whole patient care rather than just getting patients in and out through the door.
As for being part of a unique community health centre like CHIGAMIK, Dr. Schechter is quite impressed with this facility.
It's not only breaking boundaries between French and English, but it's also breaking boundaries across First Nations and Western culture. It's also breaking boundaries between Western medicine and non-traditional medicines. We're getting a naturopathic physician in here to consult on various patients who are not able to meet their needs. We also have a traditional healer, and that's another wonderful way that our center can really meet the needs of the patient. And I think it's incredibly important as a community health center that we actually go out to the community and meet the patients where they are, just like physicians try to do in the office. We always try to meet patients where they are so that we can best help them.
For those interested in finding out more information about becoming a patient at CHIGAMIK, Amanda says all you have to do is pick up the phone.
One of the most important things for the community to know is that we are not a walk-in clinic. Our clients are registered to the Community Health Centre. If people want to learn more about becoming a client, they can always contact us, and our phone number is 705-527-4154.
So, George, as Amanda mentioned, the number one thing she wants to get out to the public right now is that they are not a walk-in clinic. You need to call them, or you can visit their website. It's a really in-depth website for more information, and that is www.chigamik.ca. George?
So, Elizabeth, you mentioned they have 700 clients to date after being open for about a year. Do they have a cap on the number of clients they'll be able to help?
Well, George, I too was surprised that the number of clients right now is over 700 and they haven't even been open for a year yet. However, Dr. Schechter tells me that he's surprised it's not higher. Amanda Olszewski tells me that they can accommodate at CHIGAMIK up to 3,000 clients. In Midland, I'm Elizabeth Smith.
And CHIGAMIK will certainly help to ease the doctor shortage in the Midland Penetanguishene area, but there are still thousands right across Simcoe County who do not have a family physician. These numbers were released earlier this year by the Rural Ontario Medical Program, and they show that in the Midland Penetanguishene area, there's still an extreme doctor shortage. They're short 15 physicians and 16 specialists. In the Alliston area, there's right now a need for 7 physicians. In Orillia, there's currently a shortage of 15 physicians and 15 specialists. In the Barrie area, which includes Innisfil, there's a shortage right now of 25 physicians and 20 specialists. And in Collingwood and Wasaga Beach, right now there's a shortage of 5 physicians. Stay with us on Inside Simcoe County. When we come back, the Christmas Cheer campaign is now underway. How you can help or receive help next.